Hi, today we're going to be going over the drug label for Lamictal so we can cover all of the risks of this drug. And so if you are taking Lamictal or if you are thinking about taking it, you are fully informed of all of the risks as per the FDA labels. I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist, and I used to work at the FDA. First thing that we want to look about with Lamictal is what is called the boxed warning up here. The boxed warning is about something called Stevens-Johnson syndrome, and this is a life-threatening rash. So usually when you start taking Lamictal in a small group of people, they will develop this rash on their arms. It's called a non-blanching rash. So when you put your finger on it and you press on it, it doesn't go white. Normally when you put your finger on a rash and you remove your fingers, it'll turn white for a period of time and then go away. Stevens-Johnson syndrome, that does not happen. And how this progresses is that eventually you start to lose your skin. It literally just sloughs off your body, and it's life-threatening. And so what we always tell people is if you take Lamictal and you get a rash within the first couple of days of taking it, you should immediately stop it and you should go and talk to your doctor. So it's indicated for use in a couple different populations. It first started as a drug for epilepsy, but it is also used in bipolar disorder, and it has an indication for the maintenance treatment of bipolar 1 disorder to delay the time to occurrence of mood episodes, depression, mania, hypomania, mixed episodes. In patients treated for acute mood episodes with standard therapy. Okay, so it's a bipolar drug. It holds a contraindication, so this means it should never be used in this population, and that's in patients who have already demonstrated a hypersensitivity to the drug or its ingredients. So let's go over the warnings and precautions. So we already talked about Stevens-Johnson syndrome. This is the first one where it talks about the risks of serious rashes. And now I'm going to kind of lump together several of them. So we have this hemophagocytotic lymphohistiocytosis, multi-organ hypersensitivity reaction, and organ failure. And so what we're going to do is we're going to lump these two together because these two actually go hand in hand with Stevens-Johnson syndrome from my perspective. These are autoimmune type problems. These are immune system problems. And typically when I've seen these turn up in patients, they develop kind of symptoms kind of all over their body. And they're kind of like these non-specific kind of aches and joint pains and headaches. They can get something called like aseptic meningitis where they're just having these headaches all the time. They get rashes, big lymph nodes, coagulation problems. They're signs of systemic inflammation. Sometimes they can affect your organs, and you can have things like hepatitis, inflammation of the liver and the kidneys. And it kind of feels like these acute viral infections, these kind of very inflammatory states. And these can be really subtle sometimes. I've seen patients who have been on Lamictal for several years, and they start thinking that they have things like Lyme disease. They start thinking they have things like mold toxicity because they just go, what is happening with my body? Why do I have these rashes and joint pains and headaches all of the times? But they're actually having this kind of autoimmune type reaction from Lamictal. So that's how that really turns up. Cardiac rhythm and conduction abnormalities. This is really common with a lot of the psychiatric medications. There are a small group of people who will have a tendency to go into cardiac arrhythmias because of them. So if you're taking this drug and shortly thereafter you're having arrhythmias and things like that, you want to think about this drug as being possibly related to the onset of that arrhythmia. Suicidal thoughts and behaviors. So this is common for all of the antidepressant medications. And really it's because this drug can cause paradoxical reactions. Any drug that you take that acts on your brain has the potential to cause a paradoxical reaction. So what does that mean? So instead of it being calming to take, which is the primary therapeutic effect of most of these drugs, it actually can cause agitation, disinhibition. And if you have someone who is already depressed, and you put them in a state of agitation and disinhibition, they're more likely to become suicidal. And so what you want to make sure of when you start someone on this drug is that you check in with them very frequently, right at the beginning, and you just let them know, if you're getting worse and you're feeling worse and it's not really making sense in the context of things happening in your life, you may want to consider that it's your drug causing it and you want to stop the drug, come in and see me immediately. So if you start any psychiatric drugs, but just like Lamictal, always be aware that there could be this paradoxical response and you need to watch for it closely. So aseptic meningitis, again, this is kind of going in with that whole kind of strange autoimmune systemic inflammation type thing. So meningitis, you've usually probably heard of this as the bacterial meningitis that children get. But yeah, you can get a non-viral, non-bacterial type of meningitis with Lamictal where there's inflammation of the meninges. And people will have headaches and chills and, light sensitivity and all the signs associated with inflamed meninges. Nuchal rigidity, that's like a stiff neck. Oh, here's one that's important. If you are taking an oral contraceptive pill, or Lamictal, actually makes the oral contraceptive pill less effective. And so you may want to increase your dose of the oral contraceptive pill. This drug can cause seizures if it's withdrawn too quickly. That's not surprising because it is used as an epilepsy medication. So when you pull it out, it may precipitate a seizure. So you want to do the removal very gradually. There's also a risk here called sudden unexplained death in epilepsy. I guess this was something that was observed in the epileptic population. The risk talks about they're not really sure how it happened. But when I look at this, I start thinking about, maybe cardiac problems or maybe seizures that went unwitnessed, and that's what led to people dying unexpectedly after they started the drug. One other risk is if you're taking this drug with Depakote, which you could probably be doing either in epilepsy or in bipolar disorder. You frequently can use those drugs together. You want to halve the dose of Lamotrigene because Depakote increases the serum concentration of this drug due to interactions with the metabolism of it in the liver. Another risk has to do with eye damage. So what they've noticed is that Lamictal seems to bind to melanin-containing tissue in the eye. This is more of a warning because they don't really know the impact of this, but they're saying that they have observed this in their studies. And so if people are developing kind of progressive vision loss while they're on this medication, they may want to consider that it's related to Lamictal and consider coming off the medication. And finally, if you take Lamictal, you are more likely to have a positive urine drug screen for PCP. So there's something about this drug when it's expressed in the urine that could light up for that. And so you may be falsely accused of using PCP, and so you want to be aware of that risk as well. For pregnant women, the data on whether Lamotrigene causes problems is mixed when you look at the label. However, when they looked at this in animals, they found that there were an increased rate of skeletal abnormalities in the rats who were born to mother rats on Lamictal. So although what we've seen in the registries isn't conclusive that they cause damage to the fetus, that would be by presumption. And so you would want to be very cautious if you are thinking about getting pregnant with taking this drug, and just be aware of it. And you want to talk very carefully about the risk-benefit decision of you being pregnant while you're on this medication. The other thing you want to keep in mind is that this medication is expressed in the breast milk as well. So you want to watch your child closely when you're breastfeeding them if you're taking Lamictal, and look for any behavioral problems or any other kind of signs of a Lamictal toxicity in your child. And finally, if you have liver injury or if you have renal injury, you just want to be more cautious with using these drugs. You may need to adjust the dose, and this is something that needs to be done carefully with your doctor. Putting aside epilepsy, because that's not where I specialize, we're going to talk more about how I see it used in psychiatry. So I frequently see it used for irritability and mood swings, and I see it being used for depression and bipolar disorder. If you need to take a mood stabilizer for this condition, the other options aren't that great either. There's lithium and Depakote, and while they may be more effective for some people, their risks I would consider worse than Lamotrigene. And so if you needed to be on a medication, maybe Lamotrigene's a little bit better, but that's really patient dependent. And if you're going to take Lamotrigene, you want to make sure that you're watching really closely for all of these strange systemic inflammation and autoimmune things, because these are frequently missed by doctors.